And welcome back to the Nutrimedical Report. We are live with, of course, Clay Cross in our first hour of Mondays. Great way to start off the Monday with Clay. He's got a very understandable voice, very great mastery of the Nutrimed line, and, of course, the compassion to try to help you get well. As I say, the only way to wellness is, I call life care, where we're trying to add life years to your life rather than misery. And we're not talking about health care where you're taking toxic polypharmacy. As I said already, 20% of drugs are appropriate 20% of the time. The rest are probably either dangerous or unnecessary if you take the right diet, lifestyle, and especially Nutrimeds, which are activated forms of nutraceuticals. They're not like anything else out there where they'll say they have this or that type of product. You know, it's the big box vitamin stores or longevity or any of these things. They're not in the activated forms of vitamins. They don't have tracks amino acid chelates. They don't have jump the gene defect or the toxic polymorphisms. And they don't have the medical integration to the entirety of what I call functional medicine. And that's what's really important. I want to start off with some kind of different problems. I had a really interesting request from a lady who has very bad digestive problems and constipation. And I'd like you to kind of fill in the details. First thing with constipation is colon cleanse. Tell us all about colon cleanse, how this will be, as I say, bust the dam and keep you moving. It's very common to see, especially in females by the time they're in their 30s or 40s, but it happens in males also, ignored to their demise because they end up with diverticulosis or other problems. So tell us all about colon cleanse. What's in it?
Yeah, well, you have a magnesium citrate in there, which is a really safe form of magnesium that helps draw water to the bowel. Cape aloe leaf and triphylia extract. So it's very gentle, something you can use long term. It's been used for centuries, these herbs and ingredients in combination for a long, long time, especially in Ayurvedic medicine, which is from India, but very effective at helping with digestion and helping you go to the bathroom. You take one before you go to bed, and if that doesn't do the trick, then you add another each night till you actually get to go. A lot of people just need one, but sometimes you need up to 3 or 4, sometimes before bed. But that's for really, really tough cases. Right.
Now, for digestion, and again, oftentimes if I get a QRMA test or if I have a CDSA2, which is a comprehensive digestive analysis tool done at Genova Metametrics Lab in Atlanta. And by the way, they can order the test at directlabs.com, and the test kit will come out right to your home. You can send the stool back. They use DNA probes, grow cultures. It's more accurate than the LabCorp or Quest type stool analyses by far. But the QRMA will tell you also if you have low levels of pepsin and hydrochloric acid, low levels of digestive enzymes. And this lady, of course, I'm recommending Digest Ease and Gastrozyme, the 1-2 punch for improving digestion. Digest Ease, normalizing your stomach acid production and pepsin, and Gastrozyme, the most broad spectrum pH range enzyme capacity available, even for getting rid of gluten. So can you tell us about what's in the Digest Ease and Gastrozyme?
Yeah, Digest Ease, you have 2 different forms of hydrochloric acid. You have the L-glutamic acid and the betaine HCl. So 2 different forms, really good forms, the highest quality forms of HCl, because a lot of people don't have enough hydrochloric acid in their stomach to break down the food that they're eating. And then we also have in there pepsin and gentian root. Gentian root's been shown to help repair the parietal cells, which helps you to then normalize your function of HCl. So very effective. 1 with each meal, pretty much all you have to take to regain normal function. And then the Gastrozyme I really like because it is a broad spectrum, pH balanced digestive enzyme. It works in a broad range of pH, so from 2 to 12. So it works in the stomach, works in the duodenum, in small intestine, without getting denatured. It has in there digestive enzymes for protein, fats, carbohydrates, but also for fibers, for beans, for lactose, and for gluten. So really the broadest spectrum or range of digestive enzymes you can get in a capsule. Very, very effective.
Yeah, better than anything in big box stores or online. The next that I recommend is very strongly. A lot of people don't realize that less than 2% of the population has the capacity to break down lactose. But until now, including the drugs that the doctors give, lactose enzymes, there has never been a neutral pH lactase which works in the small bowel, the large bowel, anywhere throughout the colon. And this lady, of course, with constipation, very commonly what people don't realize, lactose, including foods are cheese, yogurts, milk products, even breads. It's ubiquitous. There's lactose, and of course lactose is glucose and galactose. If it's not broken down in your body and absorbed, it acts as a food to create dysbiosis or abnormal gut bacteria and pathogens in your gut. So I recommend this lady take lactose blocker, 1 capsule, depending on the size of the meal or the sugar we call lactose level load, depending on how much milk or cheese or whatever you're eating or pizza, 1 to 2 capsules before all milk products. Can you tell us about lactose blocker, why it's so important for people trying to get their gut under control and not have a leaky gut or dysbiosis?
Yeah, well, one way to even identify if they need it is if they get any kind of abdominal bloating or pain or gas after they eat anything with dairy in it. And if they do, then they definitely need to take this product before they ingest those ingredients. A lot of times people don't even know that there's dairy in the foods they're eating, so you could just take it as prophylactic before each meal anyway.
Yeah, exactly. It's so common. Next is you have to recolonize the gut. We recommend Living Probiotic, a capsule twice a day. It's the Rizal 6 strain from Paris, the most powerful regular strain, and we have the Living Probiotic Ultra that's so powerful. It's the nitrogen sachets in a bubble wrap, bubble container, and these bubble things will hold the Living Probiotic Ultra. It's so powerful you can take it before you go to Haiti and you won't pick up cholera. The Ultra form is what I tell people to take 1 every 3rd day, roughly, unless you have really severe, like inflammatory or microcolitis or villus inflammation of your small bowel villi. So tell us about Living Probiotic and Living Probiotic Ultra. Why are these so important to recolonize the gut?
Well, Living Probiotic's been used for 20 years. It's been shown to be quite effective at even low doses. And then the Living Probiotic Ultra, I really like. It's the newest state-of-the-art research in terms of human strains, 100 billion per capsule. So it's just like giving your gut a bomb of good bacteria to replant and repopulate the area, especially after somebody would use an antibiotic and wipes out that area. It's great to get something like Living Probiotic Ultra in there. 1 cap a day is max dose. Sometimes you do 1 every other day even. You can still get a great result.
Now, we want to clear out the pathogens out of the gut, and the first 2 things I recommend would be Allicin Med, at least a capsule twice a day, and berberstatin or berberine. It's the very best form of berberine available on the market anywhere, professionally for physicians, etc. Tell us about Allicin Med and berberstatin, why these are so important.
Well, the berberstatin is a really great product for helping to remove pathogenic agents in the gut. It's a remove agent, so it'll be, in a sense, the natural Mother Nature's natural antibiotic. And so within it you have zinc, Oregon grape, which gives you berberine, bayberry extract, and grapefruit all together in one. And together they make a really great complement to help with antimicrobial activity that's happening in the gut. And a lot of times this won't destroy good bacteria. It just goes after the bad bacteria. Exactly,
which is amazing. Yeah. And it penetrates through the biofilm, which can be a problem, especially if you get fecalist, or we call these undigestible fiber lists that get in the weak points in the bowel wall and form little up-poachings called diverticuli. The next one is one that I'll talk about called IBS Care, and I have custom this product. It's a slow-release form of carnitine. It's a slow-release form, and it'll help to normalize the myenteric plexus of the bowel wall. So that's pretty important in order to restore bowel wall function. So that protocol I'll post up shortly. By the way, before I proceed, I want to say a little prayer for a pastor. I won't mention his full name. His first name is David. He's in Texas. He had a prominent radio show for years worldwide. He's in pretty serious extremis right now. We want to pray for David. And I pray we'll get some wisdom. I just got a call from one of his people that knows him very well. We'll pray that he will get well, that we'll get the knowledge to know what to do to help him both here, if we want to refer him to special clinics, what advanced medical care he could take, what nutraceuticals, and what interventions at special clinics, perhaps in Mexico or elsewhere, to get him well. Back in just a moment. Your questions at any hour, 800-259. And I have another challenge for you, expert Clay. This is products I'm sure you know backward and forward. We had a gentleman who lost a pile of weight and he has loose skin. And they want to know, what do you do to tighten it? Well, of course, ultimately you may need plastic surgery to tighten it. But here's a few things that I think are very effective if you let the body do it by its own self. And the first one, for tightening skin, if you've lost a lot of weight, is Collagen Max, and we'll proceed with a few other ones, but let's start off with the Collagen Max.
Yeah, it's choline stabilized organic silica, and so because it's choline stabilized, it doesn't polymerize the gut, so you can actually absorb the silica, and what it does, it gives you the body the ability and raw material for type 2 collagen to help with fine lines, wrinkles in the skin, repairing of wounds, thickening of the hair shaft, and strengthening of nails.
Yeah, it's quite amazing, actually. We have people that they take it for a few weeks and you almost can't get them off the phone. They're so excited. And it's not just women, it's men, too. They say, I can't believe it, my nails don't break. My hair's thick again. My skin, I can't believe it. People are saying, what kind of makeup are you using? Your wrinkles are going. And we're talking about a few weeks. Now, the studies done in Europe with this product have shown in 6 months, I think it's something like almost 47% reduction in photographically proven by independent double-blind studies proven wrinkle reduction. Now, it doesn't just stop wrinkling on your skin. It also improves the collagen in your bones, your connective tissues, your ligaments, your hydroviscous layer in your eyeballs, your joints, which is a hydroviscous layer, so cartilage doesn't touch cartilage. All of these things amazingly happen. The next product I'm going to recommend is Her Majesty's Royal Jelly, which I'm an expert on. It increases pro-collagen, so we're using that. And then Mountain Red Velvet, we recommend 1 capsule opened under the tongue 3 to 4 times a day. We're soon going to have a special capsule type, which I recommended and will be basically being the exclusive distributor in the world for the DR cap version of Mountain Red Velvet without xylazine, the cleanest and highest quality Mountain Red Velvet. And then finally, this is a product I want you to explain. It's called Curcumin Cream, which is liposomal curcumin. This is a miracle cream for regenerating your skin. If you want to moisturize your skin, you want to regenerate your skin, you want to turn off free radicals and sun damage, solar damage, ultraviolet light, tell us about curcumin cream. Why is this so important for healing?
Well, it's nice to be able to get the curcumin right to the skin, right to where you need it most. And so with the liposomal delivery system, it can get there a lot more effectively than just taking oral curcumin, because oral curcumin then is absorbed by the body and goes to all different areas of the body that may need help. But if you want some special pointed results, then I like the cream.
Yeah, now I'm going to give you a recommendation for a cream you can make yourself. You take as the base, you have a used, let's say, cosmetic jar for cream. And you put into the jar 2/3 of the volume, you fill it up with the pump, use the pump and put curcumin cream in there. You add 10 drops, this is by the way for cellulite. If you want to get rid of cellulite, you put 10 drops in the container of Nutridyne. You open up 4 capsules of VascuCare, which is a propionyl L-carnitine. You puncture 4 soft gels of CoQ10 Supreme. Okay, and then you puncture 4 of the soft gels of the Her Majesty's Royal Jelly. What that does is it increases metabolism dramatically of your adipocytes. So when it's penetrated, the liposomes carry it into the skin, and what happens is it speeds up the metabolism of your adipocytes, because really, when you get fat deposits like around your middle or other areas, that fatty tissue has actually gone into what's called stasis. In other words, it shuts off its metabolism, it pulls in calories, and when it gets a certain size, the fat cells actually divide, so you get more fat cells. So that cellulite cream, I'm going to post that up on the site. If you were to pay to have this custom made at a pharmacy or custom compounder, it would probably cost you a few $100s a jar, but you can do this for a fraction of that, 1/5 of that cost. And you can do it yourself at home. And I'm adjusting and modifying the formula as I go along, so that will be posted up on Nutrimedical. So people have asked for a cellulite formula. This works like crazy. Getting rid of double chins, love handles, other areas. It works by basically boosting metabolism of the adipocytes till they mobilize the fat and burn it off. Interesting, hey?
Oh, yeah. Real good. Have you tried that yourself? Is that the one you guys use here at your house? Or
it works, yeah. It does work. Yeah, it works, yeah. We also, let me have a little look here at some of the interesting, here we go. Okay, I'm looking at I get so many different interesting consults. Let's see now. And by the way, some really interesting guests we're going to have. I'm going to keep it as a secret until we have them pop on the air, or I put a notice out here. Let's see. Yeah, by the way, the Dr. U book is coming along very nicely. It should be ready for the 4th of July sale. That book will be ready as a ebook, and we're also going to have it set up so people can purchase it and get ring-bound version of it. And it will change medicine and functional medicine forever. It'll bring it into the 21st century, which basically is going to be a huge leap. Even for doctors already doing functional medicine and biochemistry, let's put it this way, this will put them to a state of shock as to the level of science that we're integrating together, including advanced functional medicine, advanced medicine, quantum biophotonic medicine, and genetic medicine and epigenetic medicine as well. We're going to integrate it all into one overall framework so health professionals or grandmothers can learn how to become Dr. U. And it'll still change everything. We're going to integrate the best of all. And by the way, when people think they can get something better than our Nutrimeds, it really is kind of foolish, isn't it?
It is. Yeah.
Why would people think that? I mean, do you understand why people would even think that? It doesn't make sense to me, does it?
No, well, they believe lies. So.
Yeah, they do. They believe lies. It's really unfortunate because they waste money. They put themselves through things that they think are going to help, and they don't. I had a consult this morning by a young gentleman who's making some progress. There's 5 different levels of what's called multiple sclerosis, and he has one of the more aggressive forms. We call relapsing progressive, which means in between spells of really bad MS, he is continuing to progress. So he contacted us several months ago to start putting him on a protocol to try to reverse the extreme fatigue and the progression of the multiple sclerosis, and we're making some progress. And we use things like cell defense. We use things to stop the free radicals like cell detox, glutathione, and Nutritrala, Regenerex. We use Neurogen, which helps remyelination, along with sphingolin, which is our myelin basic protein. We use things to mobilize, like technologies like micropulse, transcranial micropulse therapy developed at NASA to help, along with the nutraceuticals we call the signal and the substance, to help him stop his myelination, turn off his T killer cell activity, repair the DNA with malignant block. Most people aren't aware that one of the biggest things that the body does is when you're healing, it does a process called apoptosis. I got a question for you, Clay. At what time during the development of a human, during the lifespan of a human, is the maximum time when you have apoptosis going on in your body?
Programmed cell death?
Yeah. What's the fastest? What's the greatest time when that's occurring?
I don't know, in utero?
That's right. You're a smart guy. In utero. In other words, when you're remodeling in your fetus in the body, which basically in Latin means little one, you're remodeling very quickly. And when you have malignant block, and of course urologic acid and full vitamin K2 along with power C, you're speeding up that process of getting rid of senescent or damaged cells and mitochondria and replacing them. When we come back, we'll talk a little bit about these processes in just a minute with a little discussion on that and remarkable information from Clay Crossan. Your questions are welcome, 800-259-5791.
For over 5 years, you've been hearing about the Berkey guy, so you may know a few things about him. For example, you are well aware of the superior quality and effectiveness of Berkey water filters and accessories. But did you know the Berkeys have had independent lab tests done to prove just how effective they are? It's true, and he can email you the test results. Just visit goberkey.com. You may also know that the Berkey guy has helped tens of thousands of people get better prepared. Now here's something you may not know. GoBerkey.com has amazing specials and deals all the time on a wide variety of survival and preparedness products. Most ready to ship same day. Visit the Berkey Guy at GoBerkey.com and be sure to click the red Products on Sale Now button. You can always call toll-free 877-886-3653. Again, that's 877-886-3653. GoBerkey.com, home of the Berkey Guy.
And welcome back to the Nutrimedical Report. And so, Clay, let's look at some of the other interesting consults we've had recently. Give some ideas on the kind of things that are, it's amazing the range of issues that people have, and it doesn't matter which country they're in. It's unfortunate that the approach to many illnesses is being improperly treated. One of the areas I want to talk about is oral and periodontal disease, and some of my favorites are to use the HydroFloss irrigator. We've actually talked to the company. We'd like to get them marketed through here, HydroFloss. And of course, if people are using a toothbrush, the best one to get is the Philips Sonicare Platinum 1 that has a UV sterilizer, and you can dial it to actually treat your teeth. Now, what I tell people to use is take Allicin Med every day. Use to heal the gums, two things. Chew the Gastro Heal, which is zinc carnosine, and puncture and hold in your mouth for 10 minutes a couple times a day, CoQ10 Supreme. Let's talk about the Gastro Heal for stem to stern healing of the GI tract, and CoQ10 topically for gum disease. You want to get the garbage cleaned out with a deep cleaning, and the multi-step cleaning I had with my dentist here in Escondido is really one of the top 3 dentists actually in Southern California. His hygienists use a technique where they use first the ultrasound to knock off the plaque, then they use the instruments to do a surgical cleaning like a regular dentist, but then they go on and they do ozone therapy after they do YAG laser to get any pockets or whatever. So they actually clean it out with a YAG laser. Very few dentists and hygienists are certified at that. But I tell people, if you have periodontal disease, it's your sitting duck for heart disease and other problems, including everything from diabetes to stroke to heart attack to cancer. Yeah, because your mouth. So let's talk about Gastro Heal and CoQ10. And this is a novel application, but CoQ10 is very good for healing gum disease. And the Gastro Heal, that combination is very, very effective. We also are looking at launching a probiotic oral nutraceutical formula that actually will stop dental caries and gum disease by putting the right probiotic bacteria that grow in your mouth. And you do have healthy probiotic bacteria, so that's something we need to get feedback. If you out there want us to launch that kind of product, you need to tell us in emails or calls and say, yeah, I've heard about this, that you have a probiotic that can help prevent caries or cavities and actually gum disease, but we will launch that if you're interested. So tell us all about
that strain of bacteria is fantastic. I've used that as a pharmaceutical preparation, and I've given it to my son as a chewable because he had terrible cavities, and since he's been taking that, and he doesn't even take it every night, but he takes it maybe once a week, and he hasn't had a cavity since.
Yeah, it recolonizes your mouth. So let's talk about Gastro Heal and CoQ10, but I think people need to realize we have the nutraceutical power now to heal the body and assist it so he can heal itself. So let's talk about CoQ10 and the Gastro Heal for gum and periodontal and pharyngeal disease. People get allergic stomatitis, herpes virus, which of course we tell people use our Silver 100 4 times a day, and Allicin Med, which will penetrate through the biofilm. And what I like to do is put the Nutridyne in the HydroFloss machine. You can go to hydrofloss.com or get them at Amazon. Those devices, they're really good, but you want to use the other things to heal the mucosal membranes and to kill off the bacteria, viruses, and nanobacteria, because the same nanobacteria that are in your periodontal tissues are the same ones that can cause you to have a stroke in your circle of Willis in your brain, with your arteries, your coronary arteries, your peripheral, and even triggering off things like diabetes and other problems, cancer. Stealth pathogens start in the mouth. 80% of the pathogens into your body are growing continuously in your mouth, and when you get your mouth cleaned up, you not only cut cavities and periodontal disease, you cut many of these other illnesses. Don't have that feeding organisms that are going down your GI tract and into your bloodstream directly, which is why when you even brush your teeth, you have a big stream of bacteria and pyrotoxins that enter your bloodstream immediately after brushing your teeth. So if your gums are dirty and you got pockets, you're assaulting your entire circulatory system and your brain and liver every time you brush your teeth or eat food. People don't realize that, do they?
Mm-hmm. No, I don't.
So let's talk about CoQ10 and Gastro Heal.
I like the Gastro Heal. It's the zinc carnosine, and it's in a chewable form because what it actually does is if you've ever gotten a burn on your skin, what you do is you put an ointment or salve on it, right? And it helps to heal it and soothe it, and that's essentially what it is. The zinc carnosine is for the inside of your lumens. So if you have any kind of ulcerations, cuts, abrasions, things of that nature, it actually coats it so that the body then can heal itself. Very, very effective.
Yeah, and what people should realize is we're literally on our site, or I've done consults, which I'm upgrading our wellness conditions. There virtually is no health condition, whether it's a genetic, toxic, or post-traumatic, or response to toxic effects or things like radiation and chemo. I just had a request to help somebody that got exposed to very bad chemotherapy and radiation that causes radionecrosis of their bones, we can reverse that. We can bring back your bone marrow. We can even get referred to clinics that can do stem cell therapies like our Nutrimedical or other therapies where they're actually building stem cell lines that they can give you that are, if you want to call it, grown in special culture in a facility in San Diego, and they have treatment clinics in Mexico and Tijuana. If you're going to do all these things, you have to know what nutraceuticals to take to prepare the tissues, like preparing the soil so they work. And you may need a combination of everything from, I call the power of ones, oxygen, which includes mild hyperbarics, Nutrimeds, energetic technologies, that's scalar technologies such as micropulse, lumen photon, and other pulse energetic technologies like the X Vitalizer, that's a static magnetic field. We can even set it up so it has a feedback loop to create the treatment frequencies based on nonlinear physics developed by Dr. Nemtsov at the Metatron facility in Moscow, and further researched by scientists in China, Dr. Michael Chen, the engineer with clinics in Shanghai and Hong Kong. So I interact with these gentlemen, and they want me to assist them in developing the next generation of the technologies which we're working on. So, medicine's moving forward at a pace even faster than the technologies for electronics, believe it or not. Mm. So we have, a lot of people have all kinds of health conditions. We have a lot of people that have, pretty relatively mild conditions and quite serious conditions. For example, if you're trying to protect your eyes, we recommend VisionMax, Can-See eye drops, Silver 100, Neurogen for remyelination of the optic nerve head, anti-inflammatories to stop free radicals such as cell defense, then anti-free radicals, cell detox, glutathione, Nutritrel, and Regenerex. So there's no excuse for people, developing retinal problems after they've had, say, cataract surgery, because if your eyes are inflamed in the front, you're getting increased intraocular pressures because you've inflamed the canals of Schlemm, and you've got a blockage in the normal flow of the hyaluronic acid fluid, which is a polymer inside your eyeballs, because your eyeballs are inflated by a similar polymer to the one in your joints, believe it or not. And after age 50, depending on your physiology, your production of that hyaluronic polymer drops quite a bit. And if you've had increased intraocular pressures, and even if you have a cataract surgery and have a nice clear lens, the back of the eye is still inflamed. So I tell people, why should people take VisionMax? It's because you want to be able to still see in 20 or 30 years. Why should they be taking Can-See eye drops, dimethylcarnosine? Dr. Babachev in Moscow developed it for stopping glycation and cross-linking of the stroma of your lens. And why would you take things to stop free radicals? Because the eye is the most metabolically active tissue in your body. It uses up 9 times more oxygen per gram of eye tissue than even the brain. And the brain consumes 25% of your total body's oxygen requirements, even though it's only 1/25th of your body mass. Interesting, eh?
Yeah, very.
When we come back, we'll talk about the eye and other cool things. And if you have any questions on any health issue, there is no question too difficult that we will not either give you a direct, straight answer, start you on your pathway to wellness, or give you a framework to find answers and find which clinics work best for you, what best medical care combined with the best nutraceuticals and other technologies will help you on your pathway to heal. Back in a moment with Clay Crossan, our wizard of Nutriments. And welcome back, and I get all kinds of interesting questions. Believe it or not, you wouldn't believe it. Literally, people just say, Deagle's in the batter cage. I don't care. We'll throw screw balls, over balls, side balls, whatever kind of complex terminology the baseball people use. I'll try to bat it out of the court. In fact, it was funny. I was quite athletic when I was younger, and they were going to want me to try out for AAA ball because I was very good at batting. I had a batting average that was around 700, so I could literally hit almost anything and break the bats. And my attitude toward these things is I'm not afraid to be embarrassed that I don't know, or I can go back and find it. We have a situation where I have one gentleman here who is 80 years of age, and he has, of course, French-German ancestry. They asked about how to help him. He's developing, of course, dementia called Lewy body dementia, and, of course, you can only determine if you have Lewy body dementia if you actually do a brain biopsy, which I'm sure he hasn't offered to do a brain biopsy. He has a lot of back pain, and, of course, when I see a lot of people with back pain, if they haven't had trauma, I always think of things like osteophytic degeneration and spurs that hit the spinal nerve roots, which are easy to identify on axon 2 spinal A delta and C fiber scan, which I helped develop with Dr. Jim Hedgecock. Did a PhD in physiology at UC Irvine and was previously the dean of chiropractic at the Pasadena College of Chiropractic. We've had Jim back on the program a number of times, and he still teaches doctors. My last big conference where I taught doctors was 2003 up in San Francisco. We must have had several hundred doctors, chiropractors, physiatrists, orthopedic and spinal surgeons that we trained. He also, of course, has depression. Depression, of course, in seniors is very common. People need to know what the substrate is. It's not due to deficiency of an SSRI drug. And I call this entire class of drugs, I call it the kill you jack drugs. Instead of Prozac, I call it kill you jack. Because it kills not only Jack, it kills the people around him, including if he's deployed overseas in the military, or if he comes home to his family. Someday there's no restraint, and he decides that it's time to see his maker and to make everybody around him see their maker as well. So, and of course, this gentleman has a lot of shoulder pain. Typical, they throw all these things together. Well, let's start off with the top. What is dementia? Dementia is a lack of firing of astrocytes in your brain. It's a lack of formation of neural networks, and you have to form a neural network, enough of the nerve cells in the basal nuclei, that are the pacers, to set up a cortical frequency pattern where different areas of the cortex, like the visual and the motor cortex, are in the same phase and frequency to create a neural network that's then imprinted in the form of microtubules after it strikes the scalar transducing complexes on the cell membranes, that then forms facilitated pathways, starts increasing new synapses and new dendrites, and has we call a final memory, third stage memory, which is hardwired in as new facilitated pathways and neurotubules, which is non-localized. That's what memory is. So the first thing we got to do is let's start on this gentleman on Cognition Plus and brain power. Why should everybody, even before you ever get dementia, you're down to your last few good clues, why should everybody be on Cognition Plus, especially with the toxic world we have, where, and of course, most of these people are basically have what I call diabetes of the brain, where their brain cells no longer metabolize sugar properly and they've got insulin resistance. They need MCT, so they should be on coconut almond milk, mainly medium-chain triglycerides, and taking our nutraceuticals. So let's go over Cognition Plus and brain power. Why are these so important?
Well, I love Cognition Plus because you have in there activated B vitamins, so they're body-ready, B6, folic acid, and B12. Right away, this helps with stress issues, methylation issues in the brain. You have acetyl L-carnitine, N-acetylcysteine, ginkgo biloba extract. Then you also have bacopa extract, phosphatidylserine, vinpocetine, transresveratrol, and huperzine A. So really everything that the medical literature shows to be effective at helping with cognition, blood flow to the brain, everything that's in the literature is in one product, one-stop shop. You don't have to get 15 different products or 15 different bottles. Just take the Cognition Plus, one cap, 1 to 2 times a day.
Now, if you were to do advanced studies, and again, being very curious, I've ordered these. In fact, at one of my offices in Denver, I actually was within a block of the largest in the western United States positron emission tomographic scanner. And interestingly, when I was in practice in 1980, I was the very first doctor, because I took the course at the University of Phoenix on reading MRI scans. I was actually the first certified doctor in Canada to actually read MRI scans in 1980, the very first. This is before any neurosurgeons, except for the research facility at Simon Fraser University, connected with the University of British Columbia. And so I know how to read MRIs, CT scans, quantitative EEGs, you name it, I can read it. And what happens is that if you take someone like this and they say they had Lewy body, what you first want to do is do a functional MRI T1 weighted scan and a quantitative electroencephalogram. And what you'll see is patchy dysmyelination of different parts of the neural fibers. And they're under oxidative stress. I call it BOF, or brain on fire. So we want to turn off the fire, and you want to remyelinate those neural pathways. And we start off with sphingolin and Neurogen and Nutrifos, which will help remyelinate. But you got to stop the free radicals. So we use Nutritrala, Cell Detox Glutathione, and Regenerex, the big three. This is important. Then you want to restore neurotransmitters. So we use Neurival, which is acetyltyrosine. We use VisionMax Minerals Plus because you need all these trace minerals to bioconvert amino acids to neurotransmitters for the what's called the conversion enzymes called tryptase and pyrrolase enzymes, and which require things like molybdenum. Without adequate molybdenum, you can't bioconvert. We can also optimize those levels using indium, which is 49 in the periodic table. It acts as a chaperone of minerals into the cell. So tell us all about Cognition Plus Brain Power, and then go on to the, let's talk about the free radicals and turning off the BOF or brain on fire.
Well, I really like that you brought up the idea of the brain needing medium-chain triglycerides to burn as fuel, and I don't think a lot of people understand that. And there's actually prescription drugs that are just MCTs out there that cost hundreds of dollars to have each month, when all you really need is some really healthy, non-GMO, virgin coconut oil. And that's why I really like your Coconut Pure. 1 to 2 spoonfuls a day gives your brain all the MCTs it needs to.
Yeah, and by the way, we don't have that on our list of products now because people didn't grasp it last year. So it's one of our. Remember, when we have products we've quote discontinued a flavor, you can always contact us, but you have to order a large enough volume for us to justify special ordering it in. But we can do that. We can bring in the Coconut Pure for people. They can buy it at grocery stores like Sprouts or Trader Joe's here in the United States and other health food stores. I think the Coconut Pure is the cleanest. I think it's the highest quality, and you want to make sure whatever fatty acids you're having, they're not polyunsaturated fatty acids that are hydrogenated, because they're extremely inflammatory to the brain. And the blood-brain barrier is a metabolic barrier. It is not an anatomic barrier. So if you've had a brain injury like concussions or repeated concussions like in boxing or contact sports or a car accident, if you had a metabolic damage caused by diabetes or free radical heavy metal injury from, say, being a welder, or you've had exposure to high-level radiation like transcranial radiation for a head and neck tumor, or you've had chemotherapy or a cardiac bypass with an ECMO machine, heart-lung bypass, you damage the blood-brain barrier, and heavy metals, toxic chemicals, and allergens get across, and immune cells so they can actually invade and start attacking brain tissues. So people may or may not be aware of this technology, but the fact is you can quantitatively measure exactly what's going on with this gentleman rather than just guessing. And then I can actually tell people what nutraceuticals to take, transcranial therapies, mild hyperbaric oxygen with ozone, and oxygen augmentation, so you can get maximized healing. And then even they have stem cell lines now available through Nutrimedical that you can use to augment your activity. And it's not that the stem cells themselves survive, but they turn off the inflammatory reactions along with our nutraceuticals like Cell Defense, NutriDefense, which, by the way, has the most powerful antioxidant in the world. Next to that would be astaxanthin for your brain. So krill astaxanthin is extremely important to reverse Lewy body or regular dementia, because the astaxanthin will turn off the brain on fire and vascular disease. And then you want to heal the blood vessel walls and DNA. We use malignant block and the ellagic acid. So you do not need to be demented. You don't need to wait till you're down to your last few good clues. And we are the Nutrimed Answer Show. We give you answers to complex problems that even your subspecialist will not know. And by the way, I will train anybody. I won't call them, but if they call me, I will train anybody free, anywhere in the world, any physician, any scientist, any patient. And I have literally people that we help on every continent on Earth, except I haven't had any recent calls from Antarctica, from the McMurdo facility, but I did take care of people there back in the mid-90s when I was their doctor for our South Pole Telescope, SPT. Thank you, Clay. You did a fantastic job today, and don't get demented. Take our Cognition Plus and Brain Power. Neurogen. Back in a minute with Hour 2.